When a catastrophic diagnosis hits your family and you become a caregiver for a close family member who has dementia, you are likely overwhelmed on a number of fronts: emotional, physical, and even financial. Now, this happened to me when my husband John was diagnosed in 2007 with Lewy body dementia, which is a combination of dementia and Parkinson's disease, and it's the second most common form of degenerative dementia. Identifying the enemy in your new role as a caregiver is vital to handling it well and not being consumed by it. So, who or what is your enemy and who's not? Many dementia folks run into relationship problems soon after becoming the primary caregiver. This may occur when a family member disappoints you by not helping as you assumed that they would. It may also happen with medical professionals who are not up to date with the most effective methods for treating your loved one. Regardless of how it may feel at times, these folks are not your enemy. So I encourage you to learn how to manage these situations and don't allow them to drain you. Now, the first obvious cause is going to be the first obvious enemy is going to be the disease itself. So it's very important that you learn the best available treatments, the best available therapies that are out there, the things that you can do to have a big impact chemically or in terms of the therapies, the practice of certain routines and exercises that can help your person have a better quality of life on a day-to-day basis. So it's important to learn those things, to learn what kind of dementia is this, and therefore, what are the best treatments that I need to uh, be sure are included. And medication problems, medication issues are actually the most frequent problem that I encounter in my one-on-one contacts with the hundreds of caregivers that I talk with over the years. And that's pre-diagnosis and post-diagnosis. And that is because there are a number of medical professionals who have a limited awareness of how to manage specific kinds of dementia. And so you as caregiver have to take on that responsibility and don't see that person as your enemy. See this as the disease as your enemy, and you're going to learn as much about this particular disease as you can so that you can partner with that medical professional or medical professionals that you're having to deal with so that you can have smarter conversations with them. Ask key questions. Should we try this? I've learned that this may be effective. Have you had an experience with trying that? Can we try it? Maybe if we reduce this, could we reduce the amount of medicine my loved one's taking? If we titrate up, could we increase it? Maybe things would get better with something that's already worked instead of trying a new medication. Learning to do things like that, learning to recognize that this is a formidable enemy, this disease, and the more you add to your knowledge, the stronger you will be in terms of dealing with this and navigating this whole caregiver journey and making each day an easier day than it could otherwise have been. So learning about medicine, learning about those medicines, that knowledge is power. Everything about the disease, the more knowledge you have, the more power you have over your day. So embracing that instead of kind of going into a little huddle and saying, well, I'm not going to do that. I don't want to think about it. It's just too overwhelming. Getting yourself to embrace that knowledge is going to be really, really helpful to you in this season of your life is important. Now, still with medicines, what to avoid may be just as important or more important than what to take. You've heard me say that a lot if you've listened to any of my lessons at all or my videos. But there are medicines that can make things worse. There are medicines that can actually make your loved ones seem to have dementia, and you stop taking that medicine or they stop taking it, and those symptoms go away. Isn't that wonderful? I know John's neurologist, Dr. Coffer, told me those were his best days in his practice, was when he could remove a medicine from the list of medications for a patient who came in and say to them, you don't have dementia. That medicine was making it look like you did. So it's very important to know what to avoid, just like it's important to know what to take. Um, I do find that uninformed physicians do frequently create problems or make things worse when they don't understand dementia, and this can happen a lot of times in the emergency room, in the hospital, but it can also happen in a neurologist office quite frequently. So, your knowledge, being in that room and bringing with you that knowledge base, makes the conversation better, makes the decisions better. And that means your loved one's care is better. And you are outsmarting that enemy of yours, that disease, whatever form of dementia your loved one has. Now, I do want to remind you while we're talking about medicines, the two mantras. One, only one change at a time. Don't do two things with medicine. Don't take it away. Take one away and give one at the same time. Only one change. And then low and slow. Start at a low dose and then titrate up or down slowly. So, educating yourself about medicines is hugely, hugely important. Now, what else do you need to know about managing this enemy, this disease? Triggers. What are the triggers? Environmentally, sort of in the room, in the atmosphere around your loved one, what are things that are triggering perhaps bad behavior or more issues with their symptoms? Or it could just be personal communication, which we talked about the last couple of lessons. What's going on a personal level when you are communicating with that person? Or what's going on inside their body? What's happening to them? Maybe there's an infection or there's something else going on that you need to be aware of. Those kinds of things are the stuff that you need to become an expert on. What are the triggers that are causing problems? Um, and then I hope you will partner with medical professionals and see yourself as the coach of the team. You are the one who hires and fires those people. And so you have to really base yourself in a lot of awareness and a lot of knowledge when you are dealing with the enemy of the disease. How do you do that? Join support groups, take classes like this online, go and read as much as you can. Uh, get yourself, choose well vetted sources. And if you're at a place online where you're getting more agitated because of the way people are behaving, perhaps get away from that group so you lower your own stress. But go to those well vetted places where you are learning and you can feel yourself getting stronger. You can feel yourself becoming more and more aware and build that network. You're networking with other caregivers, you're networking with medical professionals, therapists, neighbors, friends, people at your church, people all around you. You're networking with those people so that you can get them to help you in this journey. It's a team sport, and you're kind of the coach of that team, and you're trying to bring those people into the story that can make things easier and better for you and your loved ones. Simplify your life as much as you can. This disease is very, very draining, and it just will sap everything that you have. And so you got to learn to say no. You've got to learn to simplify your day as much as possible and keep your focus razor sharp on what needs to be done, what's the highest priority, and then give yourself rest as much as you can. Get those breaks as much as you can. So, seeing the disease as your first enemy and using these kinds of approaches when you're managing the disease can make a big difference in your caregiver journey.